A good example of the need for a specialist is if a patient has a stroke. At the hospital, you got to get that stroke specialist there to prescribe the correct therapy within a 3-hour time window. And the types of therapies are such that if you give them the right one, you can often bring that patient back to full recovery. If you give them the wrong one, you can kill them.
I was paged by the ER for a patient that had come in that had stroke-like symptoms.
I had gone out to dinner with my daughter. I got out of the car and I realized that all of a sudden my left leg and my left arm went dead. I said, honey, I'm having a stroke. I need to go to emergency. They whisked me off for a CAT scan, and then the next thing I remember is the robot coming into the room.
I was able to get the robot up and running within minutes, and once she got back from the CT scan, we were able to diagnose her with the stroke and give the medication immediately.
Many doctors will tell you, if I could just set my eyes on that patient, I'd instantly know what's going on. Because how does agitated look? How does disoriented look? These are not very quantifiable things verbally, where if you could just interact with the patient yourself, it makes a world of difference.
For every minute that's lost in someone who's suffering a stroke, 1.9 million brain cells could be possibly irreversibly damaged.
I would not be talking to you right now if the doctor hadn't been on the robot talking to me and telling the nurses and all the technicians what to do.
I would say that she's a very good example of a quick assessment, diagnosis, treatment, and outcome.